I can diagnose a complex tropical disease. I can interpret an ultrasound with precision. I can manage a hypertensive crisis in my sleep. But nobody taught me how to read a balance sheet until I built one myself. Day 26. And today I want to talk about the single biggest gap in medical education that nobody in medical school ever addresses: financial literacy. We spent 7 years learning to save lives. We spend almost no time learning to sustain the institutions, the careers, and the personal financial health that allow us to keep saving lives for decades. That gap nearly cost me my entire vision. The curriculum gap nobody talks about. Let me describe what 7 years of medical training in Ghana actually prepared me for and what it left out entirely. I learned anatomy down to the smallest nerve pathway. I learned pharmacology, drug interactions, dosing, contraindications. I learned pathology, physiology, surgery, obstetrics, pediatrics. What I did not learn, not once, not in a single lecture, across 7 years: how to read a profit and loss statement, how to negotiate a practice lease, how to structure a business entity, how to price a service sustainably, how to manage cash flow during the lean months that every new practice experiences, how to evaluate an investment opportunity, how to think about retirement planning while still in my 20s. Medical schools across Africa and Brazil produce extraordinary clinicians and financially illiterate business owners, because nearly every doctor eventually becomes a business owner, whether they plan to or not. Why this gap is actually dangerous, not just inconvenient. This is not simply an inconvenience that doctors walk around. It is dangerous to patients and to the profession itself. Financially illiterate doctors make worse business decisions, which threatens patient access. A doctor who does not understand sustainable pricing either overcharges patients who cannot afford care, or undercharges and eventually closes the practice that the community depended on. I have watched colleagues build beautiful clinical practices that collapsed within 2 years, not because the medicine was poor, but because the financial architecture was never built. Financial stress directly undermines clinical judgment. A doctor lying awake at night calculating how to make payroll is not operating at full clinical capacity the next morning. The connection between financial well-being and clinical performance is real, even though medical training treats them as entirely separate domains. Financial illiteracy makes doctors vulnerable to exploitation. I have seen colleagues sign predatory loan agreements, poorly structured partnership contracts, and investment schemes that a basic understanding of financial principles would have allowed them to recognize and avoid. The profession that trains us to protect patients from medical harm does almost nothing to protect us from financial harm. What I had to teach myself, and how. When I founded MG Consultants, I quickly discovered that my medical degree had prepared me for none of the decisions I now had to make weekly. Here is what I had to build into my own financial education, outside of any formal curriculum: basic accounting literacy, understanding revenue, expenses, profit margins, and cash flow well enough to read my own practice's financial statements without depending entirely on someone else's interpretation. Pricing strategy, learning to price a DPC membership that was both affordable for patients and sustainable for the practice, a genuinely difficult balance that no clinical training prepares you for. Multiple income stream design. Understanding why relying entirely on clinical consultation income is financially fragile, and deliberately building additional income streams through ultrasound services, pediatric consultations, and eventually content and consulting work. Long-term financial planning, building the layered funding architecture for Harvard that I described earlier in this journey, scholarships, grants, income diversification, and dedicated savings required financial thinking that took years to develop because nobody handed me a framework. I learned through books, through mentors outside medicine, through painful trial and error, and through the simple discipline of forcing myself to understand every number in my own practice. What I want every young doctor to do differently. If you're a medical student, a young doctor, or a health professional watching this, do not wait until you are forced to learn financial literacy through crisis, the way I largely had to. Start now. Learn to read a basic financial statement before you ever sign a practice lease or partnership agreement. Understand the difference between revenue and profit before you price your first consultation or service. Build a personal budget and a dedicated savings discipline while you are still in training. The habits formed now will determine your financial architecture for decades. Seek out one mentor outside medicine, in business, in finance, in entrepreneurship, who can teach you the language and frameworks that medical school never will. And understand this clearly. Financial literacy is not a betrayal of your calling to medicine. It is the infrastructure that allows your calling to survive contact with reality. The doctor who understands money builds a practice that lasts. The doctor who does not build a practice that is one bad year away from collapse, regardless of how skilled they are with a stethoscope. This is why I call myself a global health and wealth architect. Not because wealth matters more than health, but because I learned through genuine difficulty that health work without financial architecture is work that cannot sustain itself. If this named something you have felt but never had addressed openly, share it with a medical student or young doctor who needs to hear it now, not years from now. 3 days left. Day 27 tomorrow. Mental health is public health. Why Africa and Brazil must stop treating it as an afterthought. Subscribe. Comment below. What financial lesson did you have to learn the hard way that medical or professional training never taught you? I want to read every answer. See you on day 27.